Dr. Szanton, are you pro-choice with regard to patients making individualized medical choices?
Broadly, thank you, yes.
Are you aware that your university doesn't allow choice with regard to vaccination, that you require all of your students to have 3 vaccines in order to be students?
Yes.
So it's sort of choice, but not so much when regarding vaccination. Are you aware of the increased risk of myocarditis with the COVID vaccine, particularly with successive COVID vaccinations in males between the ages of 16 and 24?
Senator, thank you for the question. I'm prepared to talk about the nursing crisis and that we have vaccine requirements across the board for a lot
Here's the problem. If you exclude everybody from being a nurse who believes in basic immunology, you're going to include a lot of smart people, people who believe that you can get immunity from both vaccination as well as infection. And if you say, well, we're just not going to take the people who believe in that old-fashioned infection thing, providing immunity, we're only going to take the people who will do as they're told. I mean, do you think individuals should be treated the same when they come to the emergency room? If you got an 18-year-old with chest pain and a 68-year-old obese diabetic with chest pain, you think they get treated the same in the emergency room?
Thank you. I will take into consideration what you've said, and I'll bring it back to you.
Well, it's an individual decision, and you ought to be able to answer, at least be honest and look backwards. The thing is the CDC says if your kid's had myocarditis, got sick and went to the hospital, as soon as he gets better, give him another one. I think most parents in the country would say that's a stupid idea and defies all common sense, and they would resist this. But when the government tells you to do it, and it's a really stupid idea that defies common sense, guess what? People lose trust in government.